Okay, good morning, everybody. I think we're going to get started. I want to just say good morning. Thank you for coming. This morning, we are going to start off by talking about advocacy. I have three of our HIE families that are going to talk about different perspectives and how they have advocated in their lives and share that experience with you. Again, my name is Jen Schaefer. I am the social worker here at Hope for HIE. And I'm going to just kind of lead off this conversation. I know when people hear advocacy, they get nervous. They think it has to be always so big and public and policy driven, because not all of us are the Betsy Pilans of the world. But honestly, there are so many moments that you yourself have advocated, starting in those early days in the NICU. Whether it was, just stopping conversations to just say, I've had enough, asking questions, leaning on your supports. That is all advocacy. It starts with advocating for yourself, getting better understanding of what you're going through and what you will be going through. So advocacy doesn't have to be about control. It's about staying engaged, which is a way to have it be sustainable for yourselves. After that NICU life, you kind of transitioned home. That looks a little bit different. Just it looks like naming your needs. Where do you need help in your life? Where do you need help navigating all of the appointments, checking in with insurance companies, and doing all of the things? Advocacy is about growing and beginning to trust some of the instincts you have as a parent and as a parent of a child that may have additional needs and understanding those needs. But we also have to remember to take care of ourselves in those times. And that is my next transition to talk for you guys to meet Laura Hayward. She is from Canada. And she is going to talk about recognizing your own needs and identity and how to advocate for yourself in those spaces. Laura?
Hi, everybody. I'm going to stand up. I think it's more. I am the mom of a beautiful 8 years old son who's severely disabled from HIE, Louis, that you can see over there. I'm also the mom of 6 years old Josephine and 2 years old Noam, little boy. But I'm also a woman who just turned 39 and feel younger than she was at 32. I'm a woman who is on her fourth getaway without kids in the last 6 months. Can you believe that? I'm a woman who loves to nap every day when she can, to do yoga. And I am a woman who makes sure that she is on her priority list every day. Every day. That woman that you're meeting today, she didn't exist 7 years ago. I had to choose her. That's exactly what I want to talk about with you today. Enough of me for now. I'm pretty sure there's a woman in the room here who hasn't thought about what she needs, about her needs, in days, weeks, months, maybe years. I want to talk to that woman today. Let's do something funny. Raise your hand if you ever feel guilty for taking time for yourself, even just going for coffee, or going with a friend, or taking a nap, or reading a book, especially while the laundry basket. Dad can raise their hand too. Thank you. Okay, keep it up, or raise the other one if you ever feel so exhausted that you didn't know how you would make it till the end of the day. And that when you're going to bed, you just lay in bed crying. Because keep it up if you can't remember the last time you did something just for you. Just for you. That could be something small, something tiny. Okay, going to the dentist is not an option, okay? Scrolling on your phone either. Now, keep your hand up, please. And I just want you to look around. Look around. You're not alone. Every hand in this room is telling the same story. You're not alone in this. Now, will you let me tell you a story? Because 7 years ago, I was exactly where you are, except I didn't know there was anyone else in that room. That's the first picture. My son Louis was 3 months old. When he was born, the doctor had told us that he would not survive. I started breastfeeding, nursing him, but they told me that at first it was the suction was like a reflex, but then he was not going to learn it at some point. So in my mind, in the mind of a first-time mom who had spent 3 months holding her breath, I thought he's still there. That means we're okay. We're out of the wood. Woohoo! I was so wrong. So wrong. That day in the neurologist's office, I understood something I had no words yet for. That life doesn't go black or white. It could be gray, dark fucking gray. That night in an hotel room close to the airport, to the hospital, because I'm traveling today, I guess. Louis was sleeping between me and my partner. He was asleep. And the room was dark. And I was laying there completely still with this wave building inside of me that I couldn't stop. I was sweating. My throat was just closing. I felt that weight on my stomach that I couldn't get rid of. I was gasping for air and I start crying and I couldn't stop. What are we going to do? I loved him so much already, but I was not meant to be a caregiver mom. That's not what I signed for. I thought my career was over. I already know the divorce statistic for the parents of children with disabilities, so I was afraid for my couple. At some point, my partner noticed that I was crying, that I was sobbing, and he reached for my hand and put my hand on Louis' back and told me, he's there. He's right there. Feel him. But I was already so lost. And I did what I now recognize as the most me thing possible. I grabbed my phone and I start searching. For what? A miracle, I think. Some solution. Something to fix this. Raise your hand if you ever feel like this. Yeah, I know it. That's when I found her. A mother writing about her story on a GoFundMe page. She's right there. And she became my first friend in that journey. And 8 years later, we're still friends together. But that night, when I was searching a way to save my son, it took me years to understand that the person who really needed to be saved was not him, it was me. That no one else could save me but me. The other picture. A few years later, one of my colleagues asked me, said, Laura, what do you love in life? Me? What do I love? I think I love my kids, but I was so shocked. I couldn't answer. I had become so good at surviving, at managing, organizing, responding to emergency that I had completely disappeared from my own life. My dad told me something one day. We were going out of a difficult appointment, and he looked at me and he said, Laura, he said, Louis, no matter what you do, he will never ride a bike to school. But you need to take care of you because you're in there for the long run. What could I do? My arms were so full. I had no way to take care. I knew I had to take care of me, but I didn't know how to do it. I used to think that to take care of a child with disability, you need to stay physically strong, go to the gym and be able to carry, to lift. But I quickly realized that if you don't take care of your art, your mind, your inner world, you're not going to make it. But it didn't happen overnight. Taking care of yourself, recognizing your own need, something that happened gradually, small permissions, moving my body, learning to recognize my own needs, setting boundaries, leaving the house for a few hours without feeling guilty, finding tools, learning to exist for myself, rediscovering that new version of me, the new me, because the old me was gone when my son was born. And here's what I know now. You can't wait until they leave the house, especially if they're like my son and will probably never leave the house, to take care of yourself. You can't put yourself last for 5, for 10, for 20 years and expect to be still there, really there for them. If you want to be a good mom, a good dad, you need to take care of yourself. The most radical thing you can do as a caregiver is decide that your story also matter. That you are not just a supporting character in your kid's life. You are the main character of your own life, of your own story. And that is one of the most powerful form of advocacy that you will ever practice for yourself. And then it allow you to be there for them. But what does that actually look like? Especially when you're so busy that you don't know how to do it. You met that woman at the beginning of the talk. The nap, the trips, but it's not only that. And it didn't come easy. I had to choose her again and again and again and every day. I'm not delusional. I know that there are days that it's impossible. Days like if you're at the hospital, if your child's not well, no nap, no escape, no possible, no quiet. You can't even met your own needs. Survival mode. But here's what I learned. Being the main character of your life, it's a posture, it's an identity shift. It's remembering that the world won't fall apart if you take an hour when it's possible. It's remembering that there are days when it's not possible, but you can notice your need. You can tell yourself, okay, I know that you need that, Laura, but it's not possible today. I'll give it to you tomorrow or in a few days. When it rains, you have two options. You always have two options. You can put your boots and go outside, or you can complain all day. That's one of your power. There's no 10-step program, but I will give you one thing to start with if you want to start to advocate for yourself. Change the way you're talking to yourself and start talking to yourself in a way that you would talk to a friend. Instead of, you feel that you would need a break, instead of telling you, oh, you should not, your mom, your dad, that's your kids, you need to take care of them. You signed for this, blah, 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 blah. Shut up. and just be aware of it and be kind with you. And on those days, that's where the inner shift mattered the most. The way you talk to yourself, the way you listen to yourself, the way you see yourself as someone who matters. And here's the last picture. Something else happened too when you start taking care of yourself, really. The more you do it, the more you stop fighting reality. And that's when acceptance starts. Anyway, for me, that's how it happened. Not as giving up, but as opening up. When you allow your story to be about you too, doors open that you couldn't even see before. And I don't know if you have that sentence in English, the gift behind, some struggle, the gift behind the disability. I used to hate that sentence. There's no fucking gift behind that. And then you start seeing it. For me, it meant reimagining my entire career. For me, it meant having that third child that I don't think we would have had if Louis hadn't been who he is. You can't see the gift at the beginning, but you can't get there to the place where the gift becomes visible if you are not in the story. That permission, No one can give it to you. Only you can. Because taking care of yourself, that's not selfish. Disappearing, that's the real risk. Thank you.
Thank you, Laura. So I think the takeaway is once you start finding yourself, finding your voice, we start to strengthen other areas. And I kind of want to have Sarah Pendleton here as our guest to transition into growing that self-care into advocating in different spaces. In our space, there's a lot of talk about schools and transitioning into that school setting. So, Sarah, if you wouldn't mind starting us off, I know a lot of parents dread entering that world and the IEP process. If you can talk a little bit about your journey through that process and advocating through that process.
Hey y'all. That's hard to follow. That was excellent. I came prepared for IEPs with absolutely nothing. We had an excellent early intervention team who walked us through every step of everything, and I thought I was good because they walked us through the IEP every year from 3 years to 5, with both my daughter Ansley and our son Isaiah now. So I felt like I was prepared and I knew the IEP process, but what I wasn't accounting for is that every school is a different situation. Every school has different abilities. Every school has different ideas about what is good for children. And I was coming from um, wonderful, unimaginably excellent, inclusive early intervention program, the Children's Center for Communication and Development at University of Southern Mississippi in Gulfport and Hattiesburg, and they have they are completely donation driven, and so they have lots of grants, lots of donations, and lots of very passionate people. And then we moved into the school system where you've got the passionate people, but the funding is not the same. And the resources are not the same, and the educational goals are not the same. There's no standardized testing for a 3-year-old. So, but when you enter the school system, it's a lot, by and large around here, a lot of it is about testing and scores. And so I came to the table like, oh, cool, I got this. They wrote it for us, and we carried our IP in. But what they didn't know and what I didn't know is that there are different things that you're allowed to have and you're entitled to have and your child is entitled to have, and nobody tells you those things. So for me, it was very shocking to come in and have a plan set out, and then it doesn't look exactly like the plan because they don't when we were in preschool, our plan was XYZ, and they did XYZ every week. But then you come into a public school setting and there are 9 children in a classroom with all the same needs and 4 teachers and assistants. And the one thing that I like to express is that even when you feel like you know, and even when you have an excellent team, because our school district, we moved into it to be in an excellent school district. We sold our house, moved because we knew this specific school district had such excellent resources for kids with disabilities. And even with that, there are so many things that I didn't know until I was in it. And that's okay. I felt at first like we had failed, like, oh, this was going to ruin the school experience. I didn't, why isn't it this way? Why isn't it that way? And IEP is different for every single person. That's why it's individualized education plan. Every child has different needs. But the main thing is that when you think you know everything, when you have an excellent team, when you have read, checked on the things online, there's always going to be something that you miss. And it's okay to come back and come back around to that. I just recently learned that we did not have to provide my child's equipment to the school. I had no idea. I read lots of things. And Isaiah's stander has been at the school since the beginning of the year, so he hasn't had a stander at home on the weekends. I just recently learned that. And I thought, and I'm experienced. We've been doing, Ansley would be 12 this June, and we went through the process with her. And never did I come across the fact that the school was required to provide any equipment that he needed. So here we are, close to the end of the school year, and I'm going to have to double back. And I'm going to go in there and I'm going to ask them to provide that and say, why hasn't it been? What do we need to do to get it provided? Because he should have his own equipment at home. And it's scary, especially if you have a good school. I know a lot of people's experience is a fight, an argument, like a very tenuous relationship with their school. But for some of us, we have an excellent team. They love our children. They have been there. They support us fully. And so I think the thing that holds me back more than anything is fear of rocking the boat, fear of retaliation. But when it comes to school and education, especially with those of us who have kids on the more severe end of things, you have to remember that you are not in this to make friends. Sometimes I, for myself personally, lean more towards I've got to deal with these people for the next 12 to 18 years, and I don't want to be fighting. I don't want to argue. I'm very timid when it comes to speaking in front of people, talking to people, and interacting with people, and I find myself wanting to hide in a corner. But my job, I have to remember that my job there is not to keep things peaceful for myself or keep things easy for my children. It's to fight for what they need and are entitled to. And it's a process, and you can never let your guard down. You have to keep, the thing that I have found the most helpful is to keep, we have a notebook, we have a binder, and I keep the IEPs in there. And I have started checking our IEPs against the state laws and what he's able to do and what he's able to have. And that's been very helpful in our process.
Has there been anything that you learned along the way that you wish you would have known in the beginning? Anything like advocacy groups?
Yes, I wish I would have I wish I would have known that the main thing I wish I would have known or understood more is that I am a contributor to the IEP. Our experience has been walking in, and a list of goals has been set out before me, and a list of what they're going to do to meet those goals has been set out before me. And towards the end, they'll say, well, do you have any input? But what I failed to really interpret from that is that I can set a goal. I can say, I don't like that goal. I can say, that goal doesn't seem reasonable. Is it reasonable for a child who has vision and hearing difficulties to recognize ABCs? Not necessarily. Is counting from 1 to 3 a reasonable goal? No, it's not. And if you see goals like that, then you need to, and I'm speaking because I know some of us out here, I've talked to some of y'all today that I'm like, y'all should be up here. But as someone who is timid and as someone who is not confrontational, I'm speaking to those of you who tend to just accept what's given and say we're glad we get anything, because we did have to push. Our school system has a county school for the children who are disabled. They all go to the same school. It's easier and more cost effective to take all the children who have more needs to put them into the county school where it's only disabled kids and they have all the therapies, and it's wonderful. But I didn't want that, because my goal for my son is, and our goal in our family is to be seen. I didn't want my child in a county school where other students don't see a child in a wheelchair, don't see a child with braces, don't see a child with a feeding tube. And I wanted him to go to school with his sisters. And so we pushed and asked for that. And several other families have. And so there is a class in our school, and I pushed to have him at our public school. But I really wish that I had felt and understood more that I could say these are the things that I want. How can you make that happen? Versus these are what we want for him, and this is what we're going to do. And I encourage everybody to sit before you go to an IEP meeting and think, what do I want my child to get out of school? And make a list of this is what I want my child to get out of school, and ask your team, how can we fit that into your goals and what you have to do to meet your requirements for the school system, because they do have certain things they have to prove and require, and allow them to and push them into integrating your goals for your child into the school.
Sarah, thank you so much. Obviously, advocating within that school system is a learned skill. It's not an inherent confidence, but I think the main takeaway is to understand what your family's needs are and to request that through the school system. Thank you. Thank you. I am going to turn it over to, oh, yeah. I am going to turn it over to David Ford, our HIE board president. He is going to talk about expanding advocacy within the community, the policy, and possibly elected officials on that bigger scale. I know some people get a little bit more nervous, but David, if you would like to share your experience.
Sure. Thank you very much. So I'll just start with a little bit of background. So I have an 11-year-old daughter and a 24-year-old daughter, and my wife Heidi is over here. We live right outside of Philadelphia, Pennsylvania. So Scarlett, my daughter, is the one that was diagnosed with HIE at birth. So she made me a sign there that she flashed quickly before she went to the childcare room that says, I think it says, "Let's go, David." Hope for HIE. So actually, I got to be honest, I saw that and I just started like tearing up immediately. So, but I'm kind of glad she's gone now, because I want to say, like, just to go back to the school thing real quick, this is something that has been very challenging for us. And I can tell you right now, the elementary school should be leaving at the end of the school year. We'll probably throw a party that we're gone, because it's been tough, and we've been firm and challenged them in ways I don't think they appreciate very much. So, but it wasn't very comfortable at times, but we did it anyway. So my background before, so I run a small family business now, my wife and I. But before I did that, I spent about 10 years in nonprofit fundraising, which included, in part, advocacy and policy and things like that. That all kind of, we were very small, so I did a lot of those things. And I learned, and I've been interested in, I don't know, changing the world since I knew that was a thing. In fact, I asked my wife out partly by encouraging her to register to vote. She reminded me of that the other night, which is pretty funny. So, and I've always been interested in figuring out ways to kind of leverage power and challenge people and things like that. So I like a fight. I won't deny that. And so I kind of carried that forward. So when Scarlett was born, my wife thankfully found Hope for HIA. It was a much different organization back then. I was like, man, I'm feeling really awful. This might be a good way to channel some of that grief and trauma and all the other things. So I jumped in with both feet, and have been involved ever since, and proud to be. So I will say, when I say we, I'm not referring to me. I'm not referring to just Hope for HIA staff. I'm not referring to the board. I'm referring to everybody, every single person. So when I say we, I mean you, every single person in this room, because every one of us is an advocate every single moment of every day. And so when I say we have changed the world, I mean everybody. We've all had a part in that. Whether you've asked your doctor a challenging question, or you've gone to an IEP meeting prepared to lock horns, or you've just shown up in places where there wasn't representation before, you are part of changing the world. And the world has changed dramatically in the 11 years since my daughter was born. I talked to a couple last night that they got a brochure in hand when they were in the NICU moments after they arrived, which wasn't really a thing back when Scarlett was born. So that is such incredible progress. And how do we make that progress? So it's those little inch stones, those milestones we do in changing policy and influencing the world. So there's a saying, how do you eat an elephant? One bite at a time. You can't do it all at once. So we've done it little by little, and we've made big strides in some places. So I always start by saying, well, first of all, I will say, so I'm just speaking from my own experience here in the United States. We lead with a global perspective, so please chime in if you have some input from that perspective when we open this up a little bit. But I can tell you that, for my part, I always try and find a way to to get involved in a place where there's some sort of leverage. So like I'll look at things like advisory councils or, I once latched onto rare disease. There's a rare disease network. It's a lobbying group. And I spent like 20 minutes Googling like what defines a rare disease in America. Turns out HIA doesn't meet that definition. Well, purely Betsy and I went round and round about it. So I called the rare disease place and I'm like, I'd really like to go and lobby with you guys, but I don't know if we purely meet the definition of what is considered rare disease, but we do in this country and we do in this country and we do in this country. So that's changed a little bit over time. So we found a way to be involved. We got in front of the legislators. We talked about our needs and our work and so try to find a way to sneak in the door if you can, if you're not, even if you're not allowed to be there necessarily or not invited. I had a state senator invite me to be part of. There's like these things in Pennsylvania. They're licensure boards, and they're staffed by people that like it's like an unpaid role, and it's kind of like school boards. Like anybody can be appointed to it or run for it. You don't necessarily have to have any qualifications in that particular profession, which is bizarre. But so he like said to me, "Hey, what would you be interested?" I said, "Well, we had a difficult time with the late stage of my wife's pregnancy and the delivery process. So I was like, if there's ever an opportunity to get on the licensure board for OBGYNs, I'd be interested in that." Knowing nothing about it, but knowing that, I would have a voice there and I could say, this is how our experience went. I don't want that for any other family in Pennsylvania. Hasn't called yet, probably won't, but he knows where my head's at with things. I know some of you sit on things like, in some communities in schools, there's opportunities to sit on advisory boards. I encourage you to do that. If there's committees in whatever form that takes in government, I know some of you people have experience with things like special needs playgrounds or accessible playgrounds. That's some of you have told me like it was a very simple process. I just called and said, "Hey, I want to be part of like making this a thing," and it happened. Other people have worked really hard to make it happen. So find a place in your community if that's what you're comfortable with. I always say like in Pennsylvania, like constituent services in our state legislature is like a major thing for elected officials. So they know if their constituents find them approachable and responsive, they'll probably get reelected. So I take full advantage of that. I'll call no matter what party and say, "Hey, I remember when we first applied for Medicaid, we have a loophole in Pennsylvania. It was like, if with an HIA diagnosis, you automatically qualify for Medicaid as a supplemental or primary, depending on your health insurance." And I had a difficult time with the application because they said I didn't fill it out. That the medical assistance office said I didn't fill it out right. And I'm pretty good with paperwork, and I had worked in human services for 10 years, so I knew bureaucracies and I knew the welfare system pretty well. So I called and I'm like, "Hey, I'm curious, like, why did we get denied?" There's no income requirement in Pennsylvania for Medicaid if you meet that loophole standard, which we did. So I'm like, "Hey, can we just go through my application? Can you point to where I didn't fill it out correctly?" So she's like, "Well, I haven't actually looked at it. I just have notes here." And I'm like, "Well, pull it out. Let's take a look." So she's like, "Well, I can't right now. I have to go to the file room and grab it." So I said, "Okay, that's fine." So never got a call back. So I called my state legislator and I said, "Hey, this is the situation. Like, we're in dire straits here. We're struggling. Our daughter's, had a rough time, and my wife and I are really struggling." I got a call back from the welfare office in like 5 minutes from the supervisor saying, "It's all taken care of. Don't worry about it." And it was only because I just called my legislator and said, "Hey, this isn't right. Help me out." And they took care of it for me. So I encourage you, reach out to those people who make decisions. Those agencies, those organizations do not like to hear from elected officials because it means they're under the microscope. They like to just fly under the radar and do what they got to do to check the boxes and keep operating. So if you can find somebody that has some supervisory responsibility over them and get them excited about trying to help you out, do it. And it seems, and I also would say, if you find that your legislator has done something that affects your family in a positive way, reach out and say, "Hey, that really meant a lot to me." There's a couple things that I've done, where I've called completely out of the blue and said, "Hey, thanks for the vote. I really appreciate that. It helps our family. This is an important service, or it helps families across the country." They appreciate that too, because most of the time people call and they're angry. So when you call and you're giving them positive feedback, that actually stands out as much as calling and screaming at them because they voted the wrong way. So those are just a few little easy things you can do. I would also say, like, I think advocacy could take many forms in the sense that it might be performance art or visual art. That is I mean, what we saw the other night was so moving and so tremendous. The more people see that, the more their perception of our lives and our experiences changes, and they might understand it in a way they didn't before. So that alone, if that's your thing, make that your thing. I showed a video in the Little Dads group. It was a cartoonist that works for a publication in the UK. Did like this little 3 or 4 minute video about his experience with his HIE diagnosis and all that stuff. And it's like, to me, it captures so many of the emotions in such a simple and easy to understand way. I share it with people all the time, and I say, this is my experience, or similar to my experience. Maybe it'll help you understand. Another thing I always try to do is I always try to talk about when I go to the hospital with anybody. My mom, most recently, she had a fall in February, and I went in and I'm like, I just explained up front, hey, I've got medical trauma. So this can go, one of 2 ways. You can, like, I'm going to be on top of things. I'm going to ask a lot of questions. I don't like alarms. So if the alarm goes off, please just come down, turn it off if you can. I know how to turn it off, so I'll do it if you don't. And I just give them a heads up and say, this was my experience. And yeah, I don't get into a lot of detail, and it's really hard because we end up, most of our ER visits and people that I'm related to, when they go to the hospital, it's our local hospital where our daughter was delivered, which is not a very positive memory. That's another thing my wife and I have talked about. I'm like, why don't I start making some donations every year so we get appointed to some advisory panel for the hospital. We're not quite there yet, and I'm not sure that's the healthiest thing for me, but those are the kind of things. And not everybody's, I understand, I'm pretty unusual in many ways. And one way is I don't mind, like I said, locking horns with people. So, and not everybody's like that, but you can do it in so many different ways. I don't want to take too much time because I wanted you guys to have a chance to ask a few questions if we have time for that, and maybe share some experiences of your own. Come find me afterwards if you have any specific questions. Yeah. Is there anything else, Jen, you want me to touch on?
No, thank you, David.
Okay.
Yeah, in essence of time, does anybody have questions for any of our panelists? Yes, go for it. Oh,
So one of the things that I'm appreciating about you talking about the IEP, which we just are doing our first one. My granddaughter's 3, so she just started preschool. So we have an IEP. It's not going well. We're not seeing any progress at all. So like you said, they told us what, this is what we think she needs. She needs a half an hour PT twice a week. She needs a half. So, but we don't get to see there's no progress reports. There's no, this is what she did in her PT sessions today or her OT sessions today, so how do we, does Hope for HIE have a checklist? Like, what would that look like? Because I don't know what the things are that I should know to ask. Like, it's like, you don't know what you don't know. So until you're in it and it's not what you think it is, and then you're like, okay, this isn't, which I'm fine. I'm like you, David. I'll lock horns, especially if we're talking about this baby. I'm all about locking horns. So I also, my daughter's on your side. She's scared to death that that's going to have ramifications for Eli. She's like, I don't want anybody mad, and then they take it out on Eli. No, I'll err to the other side. But what's a good resource for us to know what are the things that we should be? And then David, for you, how did you find out about this loophole, and if that exists in Massachusetts, how would I find that out?
That's hard questions. As far as an HIE checklist, I don't know that we have a developmental checklist. I know that We've always just gone off the general developmental check. That actually is a good question.
Yeah, we do not have anything on there, but if you want to reach out, we partner with some really great organizations that have done a lot of really great work into IEPs, and we just collaborate on different opportunities. And I've sent it out to some families here and there, depending on how deep you want to go. So yeah, definitely reach out and we can link you to different resources and advocacy groups because every state has an advocacy group. You have the right to take an advocate to an IEP
Yes.
or consult with one.
That was going to be my other suggestion. One of the things I've done recently was we ended up having to hire a lawyer because our state has no advocates, and so we went ahead and hired a lawyer for our daughter who's not HIE but has significant disabilities. But I have done a lot of searching online. I found the one specific that I've been using is A Day in Our Shoes. They offer have a printout of a guideline going into an IEP meeting. Here's your questions to ask. Here's what you want to know. And another thing that I also shirked as a responsibility is when you get that IEP, there's a procedural safeguard that they give you. And I ignored that for a while, thinking because we had such a good team, I don't need to read the procedural safeguard. That's for if you don't like your people. But if you read through there, it tells you if you go through the procedural safeguard that you get at your IEP, or you can find it probably on your state website, it will tell you the exact steps when you do not agree with your IEP. You have a right to call an IEP meeting at any time. If you don't agree with what's happening, something's not working for your child, you don't wait until the next IEP cycle. You say, hey, I don't like this. We need to meet now. Certain things that they need to follow.
I just want to chime in really quick too. I think there's sometimes, and things that in our own journey, as we went from 0 to 3 to 3 to 5 to K through 12, the approach changes too. So early, it feels like a rug a lot of times, especially from the 0 to 3 to 3 to 5, where 0 to 3 is early intervention. It's all proactive development. It's all of this. When you transition to that 3 to 5, it's a deficit-based model and it's a school-based model. So in 0 to 3, it is still very much aligned more with the medical model of therapies. And in 3 to 5, at least in the US, it switches to what are we working on to access school, which is very different than the medical model of therapy. And so the goals, and that was really hard for us to learn in our journey in that switch as well. And so, that sometimes is looking at like, what is that scope change then? And that can and often is less than it was in early intervention, which is a shame because, obviously like we want to continue aggressive therapies in all settings. But sometimes it's just, like having to understand what that is. And yeah, in the US, every state does have, they call it a parent-centered hub. Every state has those resources. They obviously vary. Ours, we have county-based information. And so we have parent mentors. And that was a huge resource for me because our 3 to 5 did not go well either. It was really, really rough. And we, had countless meetings, easily had violations of state and federal laws, and just kind of got through it. But and eventually it did get better, but it's very frustrating because you know that we're all working so aggressively to help our kids. But there are those procedural safeguards. There are, those supports, and there's a lot of different programming in your local, regional, state, country levels that you can tap into, or external resources like A Day in Our Shoes, and we have a lot of those as well, so that we can connect you to.
And I just say that, so the Medicaid question. So we own a small business. We pay out of pocket for our health insurance as a family and for our employees. So Medicaid's a supplement. We can't drop our private insurance, so we actually pay out of pocket for a private policy for Scarlet. Then we have Medicaid as a supplemental. The way I found out, so we were at Children's Hospital Philadelphia. They actually pointed us in the direction of that. It's different in every state, even though Medicaid's a federal program. It's administered differently in every state. My suggestion is if you have questions about health insurance and access and whether you qualify for Medicaid as a supplemental or primary, call your local state legislator. And in other countries, you may have better systems than we do, for sure. And I also want to say one thing you can say that will get the school's attention very quickly is you can say something like, the way things are going here at school, I have concerns that you're limiting or infringing my child's access to a free and appropriate public education. Free and appropriate public education is what every student in the United States is entitled to. When you say that, you will get their attention. They will start taking you more seriously, regardless of whether you know anything more or not. It changes the dynamic, and they may recoil a little bit and sort of double down on some things, but that gets things a little more serious. And I will say, just real quickly, Betsy has done a tremendous job of finding places in many spaces, large, small, everywhere, to stick her nose in and join the fight or challenge things, and she is tremendous at that. Like the NICU Parent Network is a good organization, but it focused mostly on preemies. When we learned about it, they invited us to participate. We said, we want a little more representation of full-term children here, and so we've worked hard for that. And it's a great opportunity to find a soft spot and kind of say, hey, I want to be at the table too, and you can do that anywhere. So.
I think we had another question. You have the.
Yeah, I was going to ask Sarah if she would touch on kind of the internal struggle we had in our home with the decision to hire an attorney for the IEP and how we kind of found one, because I think that was important in kind of getting us over the hump of where we were.
Before she answers real quick, I just want to say my wife's flashed a little sign. We found an IEP Facebook group too that's been very helpful, just for our district specifically, where we could ask questions.
That's a good idea. Now I want to start a IEP Facebook group for our local area. Yeah, well, I mean, and that's the biggest thing is the more, because I had a different experience. I've seen so many parents like, I hate the school district, blah, blah, blah. And I'm like, why? They're great. But now I'm seeing it's not about the school district, but it's just the IEP situation. Well, when it came to a lawyer, we did not have, I searched and searched and searched for an advocate. And the school is never going to say, hey, you can have an advocate, or you could do this, you can find this, you're entitled to have someone here to help you. Why don't you bring someone to help you? But I did not find anyone locally. Everyone that I called multiple places. Oh, we don't do that anymore. We don't have that anymore. That's not a resource here anymore. And I was scared to find anybody from out of state. And so one of the numbers that came up on Google when I searched for an advocate was a lawyer. And so that was kind of our only situation. And I mean, that goes back to the financial impact on families of having a disability, because, just coming up with a retainer for a lawyer and entering into that relationship, and you don't have any guarantee that it's going to work or going to help. And we struggled with that. Because it was kind of, well, we put ourselves in this financial spot and figure out how to do this, or we just accept what the school wanted for our child, which at that time was a child with behavior issues going to alternative school as a permanent placement because they could not keep her contained. She is an eloper. And so we went back and forth, but at the end of the day, we realized our job is to make sure she gets her free and appropriate education, and that does not happen to anyone in alternative school permanently. And so we went ahead and did it, and it was a struggle. It was hard to decide. It was terrifying. And I will say, it has dramatically changed our relationship with the school. Very dramatically. And this is a school I love, but we are now that family, which is incredibly hard for me. However, our child is where she is safe. She is in a school. She is not in an alternative school sitting in a desk doing worksheets all day. She's in a therapeutic school. And the crazy thing about when we hired the lawyer is, as soon as we hired the lawyer, really even just the mere mention of it, when we mentioned we were talking to a lawyer, suddenly we had options. Suddenly, well, let's look at this, let's look at this, let's look at this. Do you want, well, just make sure you know that our lawyer has to get involved too, because they also, you don't really get warned that if you hire a lawyer, the school district is also it has to bring in their lawyer. And they usually have, where we had, just a lawyer, they have, one of the highest regarded lawyers in the state who's well known and handles all the school districts and is very highly paid by the school district. And it was absolutely terrifying. And it almost felt, I mean, we even made it clear, we're not in this, we're only hiring you because we don't have an advocate. But he came in like a bulldog, and he was like, tell him about this, tell him about that. And I was like, I don't know. And then he did it for us. And it accomplished what we needed to get accomplished. And I would say it was worth every penny. I would do it again, and I would pay twice. And that is just one of the burdens of families like ours, is sometimes we do have to put ourselves out there and go into difficult, financial situations to get what's needed. But when you're talking about a child thriving in school and being able to be educated, to move towards independence, to move towards what they need to, and to live a community-based life as an adult, that was just part of the situation. But I do feel like maybe had I been more educated in the IEP, had more resources and done more reading and had more understanding, that maybe I would have pushed a little harder leading up to that situation. But it definitely was a struggle.
How are we on time? Any questions? Oh, yeah.
Yeah, just a quick comment and then a question for David. We actually, for the Medicaid supplemental, we moved from Connecticut to New York, because New York also has the income exception for the secondary. And I would say that we've been navigating that process. We just got approved for Medicaid, but it's been the 7 layers of hell just going through all the steps of even getting that. And we're still not done, actually. We still have more steps to go. But I think for Hope for IE, it would be really great if they did a state by state like process, and like these are the rules around Medicaid, and these are the things that we've navigated early intervention in 3 different states in 3 years, and just every state, and they're all blue states, but they all operate differently. So even like politically, there's some differences, blue and red, but even within like-minded states, they're all very different. So you kind of know what's specific to your state. For David, I think a question on the political advocacy. How do you think about the jurisdictions of like city, county, state, federal, and where to spend your time, and where's the best use of your time in terms of advocating for elected officials?
That's a good question. I also want to say Bridget just showed me a Facebook group. I think it was FACES, FACES, all caps, that she thought would be helpful for people navigating school related things. I mean, I live a few miles north of the town I was born and raised in. We have our family business has been around for 50 years. My dad was a public school teacher, so I mean, I'm well established in the community. I know a ton of people. My wife and I play pickleball. I play with some of the parents of people I went to school with. Like, I see people everywhere I go that I know. I walk through the grocery store. I pull my hat down so I don't get stuck there for 20 minutes talking to a parent about gymnastics, which is our business. So, so I know most of my elected officials. My state representative is the cousin of our former head coach at our gymnastic business. So it's a very, like, I start where I'm comfortable and where I have relationships mean everything. So that's why I said, if you can find a positive entry into a discussion, that's always best. Or, if you can't find a positive entry by saying, hey, this is really helpful to our family and the families that we work with and all those sort of things, you can always say, hey, I want to tell you a story about my experience with the school. I go in and they're very receptive to it. So wherever you're most comfortable, wherever you might have the easiest entry point, again, collaborating with another organization like we did with what we've done with many, like, CPRN, Paul Gross, who was here yesterday, has been dynamite. He was, finding natural partners that have a similar interest as you, and riding their coattails or piggybacking or just calling them up and saying, hey, can you help me out with this? This is something that affects us, but it seems like you guys have some experience with advocacy. You can, like, with rare disease, I went in as one of 4 people that talked about our particular issue. But we all had a similar theme. We were all looking for, just to raise awareness about rare disease and how important, the research is. It happens that the congressman that we met with he's a big advocate of right to try and has some affinity for people with disabilities and has a family member who suffered with a severe disability. So I did research on what committee he's part of. That's the other thing. You can find out what committees these people are on pretty easily by Googling them. And again, it's different in every state. Pennsylvania's got a zillion boroughs and townships and blah, 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 counties. Some states are like that. Some states are a little more easy to navigate. So we have a lot of government in Pennsylvania. So odds are I know somebody in the township supervisory board. I'll know the state rep, and I can get access to the congressman or congresswoman if I need to. But trying to figure out those, like what committees they're on, because if somebody's on Health and Human Services, they probably have, you can figure out if there's legislation in process, what committee that's starting in or moving through. I mean, it's all about kind of your connection, your comfort level, the amount of research you're willing to put into it, and the best on-ramp to that discussion, I think. So hopefully that helps. If you want to talk more, find me afterwards.
Do we have another one?
Hey, my name's Megan. I'm in Canada. I have to preface my comment because I'm a human rights officer and I specialize in assisting Black, racialized, and Indigenous people in Canada. And so just to add, because I can't be in a meeting, a place, a space without talking about Black, racialized, or Indigenous people. It's just who I am. And so I just have to add to the conversation, and we don't have to talk about it, but I need to add my point is the experiences for Black, racialized, and Indigenous parents, support people is actually going to be slightly different because not only are they dealing with people's biases and racism in healthcare. I talked to a parent who experienced direct racism in healthcare yesterday. But we have to just add that into every conversation in space that our kids have, some of our kids have disabilities, and the kids have disabilities that you can see them, and they're also Black, racialized, and Indigenous. So they have to deal with racism and biases in the school systems. And so when you're talking about IEPs, I just really relate to that. My daughter is in grade 3, and not only do I have to deal with, the teachers who were predominantly white, unfortunately, just saying that, but they also have to deal with the biases. And so I brought this to the last conversation. When my daughter went to grade 1, they were like, oh, your daughter's definitely going to need an IEP. And she was only in grade 1, right? And I was like, why are we starting grade 1 like this, right? So in the opposite fashion, I was like, maybe she won't, but she did. But, I think there's an over-representation of Black kids who are sent to IEPs, sent to special education. And sometimes parents are advocating that maybe my kid, it doesn't need one, or the IEP needs to be different, or always advocating to have a higher level on our IEPs because they're putting our kids low ideas of what they need to do. So, they're saying my daughter reads at a junior kindergarten level. Okay, what about now? Okay, she's at senior kid, right? So always fighting them to move her up in this IEP world is something that I experienced. But I just want to say I really relate to the IEP conversation, but I always have to bring into the space the experiences for Black, racialized, and Indigenous people is always going to be slightly different as well. Thanks.
Absolutely. And thank you for bringing that up. That is a really good point. Unrelated to HIE, we had a foster child and she had intellectual disabilities. And just to add to that, a lot of times when it comes to race, a lot of times Black children are treated more as a behavioral issue versus a manifestation of a disability. And that is the thing that we had to fight for our daughter. We were saying these behaviors are a manifestation of a disability, but thinking back to the foster child we had who had the IEP, it was an immediate jump to the behavior there's a bias towards it being a racial issue. And I saw that directly as a parent. So I acknowledge and absolutely validate what you're saying. I've seen it firsthand.
Megan, thank you.
I just totally different than what we were just talking about. But I just really wanted to echo the Facebook group comments because in my area we have lots of Facebook groups and they are extremely beneficial. If you're not on Facebook, get on Facebook and find a group. And if you don't have a group, make a group because I see every day moms asking questions and getting answers. And if you're going through it, someone else has gone through it. I know we're all from different areas, so if you and things are different state by state, country by country. So talking to people who are local to you, who have been through it, and even like local enough to your city, to your school, too, especially who have dealt with that, can be really helpful. I know one of my friends, she's very big into advocacy. It's like her job. Like I don't even know how she gets paid for it, but she does a whole bunch of, does a million different things and she gets paid for it somehow. But she got a grant, and part of that grant was to start a Facebook group. It's called like Southeastern, like neurodivergent children of Southeastern Wisconsin, something like that. So there's like a lot of moms in there. They talk about like the waiver program and things like that, IEPs, all of that stuff. So you can bounce ideas off of each other. And also to add if you're not if you're not getting what you need, I mean, we ended up doing like an appeal for our waiver program and an item that we wanted and needed, and we ended up appealing. And then as soon as we like mentioned or that we were being appeal or that we were doing an appeal, they came and the few days before the hearing date, they said, "Oh, we actually looked at this and we're going to approve it." So it never got to like the actual hearing date. So just even mentioning things, mentioning a lawyer, things like that, it really can make a difference without even going that far. So that's yeah.
I think yeah, unfortunately, I think
Nope,
it was a
that's
great
fine.
conversation, but we had to move to our next
Yeah,
panel.
no, we could probably talk about this forever, but I want to just thank everybody, our panelists, Laura, Sarah, and David, and everybody else for your participation. Thank you.